Hey everyone, welcome to the live stream. I am glad to be back here with you guys today for another live Q&A, and I also have some medical coding news today that will tie in with one of the videos that I posted this week. So if you're here, I hope you're doing awesome today. Make sure to say hi in the chat. So let's get started with today's stream. Hey everyone, so back here today on Saturday. It is cold as anything today. It is so cold. I hope it's not as cold where you guys are because it is a freezing Memorial Day here in Pennsylvania. Very unfortunate. My daughter was very much looking forward to the town pool finally opening, and unfortunately, it closed because it's just too cold and rainy, and I actually had to kick my heat back on today because we're expecting it to get down into the 40s, which is not the best for Memorial Day weekend. But hey, I guess that's better than flooding or other things. So, just kind of hunkering down, but weather's going to pick back up soon. Really looking forward to that. So I just want to say hello to a few people that are here today. Hello to Rima. Hello, Carol. Glad to have you here today. Jocelyn, thank you for coming in, tuning into the stream. If you guys could just let me know real quick, make sure that my audio is working for everyone because I did change some settings in here and I just always want to make sure that everything is working okay. Hello to you. Hello from Texas. Hello from Pennsylvania. So I'm here in Pennsylvania. You're in Texas. You're probably having a lot better summer weather than I am having today here in Pennsylvania. It is just cold and rainy and not so great. What time is it here in America? It is 2:02 p.m. It's nice in the afternoon time. Looks like some of my audience from India is definitely in here today. Hello, hello, hello. So I want to share this article that I came across today with you guys because I thought it was so pertinent. Remember how I posted that video this week and it was about AI in medical coding, because that's something I hear so many times every single week now, that medical coding is going to go away because AI is going to take over. And left my chat box up. How do I get rid of? There we go. So, I mean, it's getting ridiculous how much I'm hearing this, but I made the point on the video that you hear this just about every job right now. You could say that about just about every job, that AI is going to take over it. I mean, the way things are going, you could say that about just about every single job. So I found this article that was posted this week, and I want to share it with you guys. So let's get over here. So this was posted in Becker's Health Review, and it says about this healthcare IT company and how they are developing AI. They're trying to bring AI to medical coding, more than 775 hospitals to optimize the revenue cycle process. Cool. So one of the key things I want to bring to your attention here about this article, and it talks about, how this is going to help streamline. And one of the key things I want to bring in, I think, is further down in the article. It says, the collaboration will help medical coders upskill, give them more time to focus on other activities, and improve the revenue cycle overall. So there is nowhere in this article that it says that this AI that they're implementing is going to replace medical coders. What it's doing is actually enhancing the work of medical coders. So we're probably going to spend less time guessing or doing less value-based work and really concentrating more on the analytical things. So this is really a tool that will help make our lives easier versus something that is going to completely replace the need for medical coders. And someone did bring up recently that, there are probably some entry-level positions that maybe will be eliminated. And I'm not saying necessarily entry-level, but I feel like if you feel medical coding is just going to be you looking up things and you assign the code, I think some of those very simple tasks will be sped up through things like artificial intelligence and computer programming, software, and analytics. But as we progress, it's just that the job might shift a little bit more. We might have to have a little bit more clinical expertise. We might have to be more well-rounded. We will have these tools we can utilize that may say, hey, based off of some things we looked at in the report or scanned through, we kind of think this is what it is. But ultimately, it still needs to get reviewed by someone. It's kind of like, I don't know if you guys use Grammarly. I love Grammarly. I think Grammarly is fantastic. And it can kind of like read my text and go and say like, hey, we think this is the tone of what you're writing. And sometimes it's like, yeah, I see what you're saying. And other times I'm like, no, I think you're off. But it's not writing the article for me, right? It's just kind of giving me some feedback. So it can scan to an extent, but not to the point that it's going to rewrite the article for me, right? I still need to hire an editor. Patty is asking, would that mean AI would take over more E&M coding? You know, I can tell you a story. So story time, all right? I used to work in a fairly large healthcare institution as a supervisor of medical coding, and we had a pretty even split of primary care practices and specialty practices. It used to be very primary care focused, but then took on a lot of different specialties, surgical specialties, as well as just medicine specialties. And we had programming in Epic that I don't think this is actually what it was called, but we used to refer to it as the wizard. And one of the providers there really wanted to use this wizard because the urgent care providers were having trouble with their coding accuracy. We were auditing them and they were not at a very good threshold pretty consistently, showing some increases as we worked with them. But they thought, oh, well, we could just get this wizard tool will just scan the E&M note and it will help us pick it out. I've even worked with providers in other practices where they have tools like Ingenious Med that will help them along in their E&M. But ultimately, it still needs to be reviewed. The analytics involved in having to take something from a large chunk of notes and quantify it into an E&M code, it's just too gray, and there's too much human thought process that needs to go into that. So like with Ingenious Med, one of the practices that I worked with, it prompted them through and it would say, hey, you could pick out what history elements you did, because these were inpatient providers. They still worked with history, exam, medical decision-making. Those still work with history, exam, medical decision-making. Thank you, Zaid World, for subscribing to the channel. Appreciate your support. And what happens is, providers have an app on their phone and they'd sit there and go, okay, I did this many histories and I did this many exams and I did this many medical decision-making points, and this is going to be this level. Well, what happened was they're thinking this is what I did, put it in their phone. Their documentation did not tell the same story. So even that was maybe the level of service they truly provided. That was the level of service that the tools told them that they did. That documentation did not support it. So E&M coding is not going to be, I don't think, ever automated. It's something that, thank you for subscribing to the channel. So I think it's something that just requires too much analytics. Now, if you don't like evaluation and management coding, of course, you don't have to do evaluation and management coding. Not every practice does E&M. Things like radiology, they're not going to do a lot of E&M, right? Surgical practices, they still have E&M, but sometimes they'll just, if you're working for a private practice surgeon, they might say, hey, I'll just bill out the E&Ms because I can kind of pick if they're a 3 or a 4 or whatever. And then you just code the surgeries. So that you can definitely get away with a long career in medical coding without ever having to do evaluation and management if it's not something that you like. So let's pause for a second right here. After all of my alerts are going on, these are probably from like 3 days ago, and they're just popping up now because something's refreshing in my system. Wouldn't that be funny? So let's pause for a second here because I want to say congratulations to Patty Tucker because she just passed her CPC exam. Congratulations to you, Patty. That is so exciting. So I guess this is good timing for you because I just posted my video on tips for CPCAs, which is probably what you are. I'm gonna assume. I always kind of assumed everyone's a CPCA, but I guess if you've been working in billing or coding for a while, you're not a CPCA. But still probably some good tips on there. So Patty, definitely let me know in the chat, what is your next step? Are you moving on to another certification? Are you in your job search? Let me know. So Richmond is asking, what is the difference of medical billing and medical coding? Thank you. So I have a video on this that will go very in depth about it. And the basis of it is, so medical coding is looking at charts and analyzing them, reviewing them, reading the whole chart, and then determining what were the diagnoses, what were the services that were provided, and converting those into codes. Those codes go onto a form, a billing form. And the biller basically makes sure that everything is formatted correctly. It goes out to the right insurance. It goes to the correct order of insurances. If there's multiple insurances, if it gets sent back by insurance, they analyze why, like what happened here that the insurance company didn't pay for it. Is it because this is a not covered service by this patient? Is it because they gave us the wrong insurance information and it should have gone to someone else? Is it because it's something that it's only covered if there's certain diagnoses? And in that case, they might, maybe go back to a coder and say, hey, this wasn't covered. They denied it because of the coding. This diagnosis isn't covered. Is there anything else in the chart that maybe they have that is covered for this service? So that's the difference between the billing and coding. Now, in a lot of private practices, the biller coder is the same person because they kind of do everything soup to nuts, especially in smaller private practices. And in small private practices, they might even do little things like pre-authorizations. So calling the insurance company and saying, hey, we have a patient here that needs this surgery, and this is the CPT code. We get authorized to do this surgery? And then that way we know that the insurance company will pay for it. So that's the difference. And coders are really more reading, analyzing, abstracting that data, converting it into codes. And then billers are the ones who take that bill with those codes on it and then make sure it gets paid by the insurance company. Or sometimes if the insurance company doesn't pay, that might be a patient responsibility. And there's federal regulations about, can you bill this to the patient? Can you not bill this to the patient? There's contractual things, like you can only bill certain services. There's a lot of regulations with like our Medicaid programs. So for our patients who get insurance through the state due to things like their income level status, that sometimes you can't balance bill them. So that depends on state by state. So they're familiar with all of those kind of regulations. And then even things like how long you have to appeal. So if something gets denied by insurance, you can appeal it, but sometimes they set certain time frames. You have to do it within 30 days, 60 days, 90 days, 365 days. Omar, thank you for coming in for your support. I appreciate you being here today. So Patty, it looks like, yeah. So you're looking to move away from retail and you're brand new to the field. Definitely make sure though that when you get your resume together and you're applying for other places that you emphasize some of those concepts that can cross over, because I know sometimes we think things like retail or childcare, there's nothing that can convert over to medical coding, but those customer service skills that you probably have, if you've worked with any systems in customer service, that maybe you've had software systems you've worked with, you're good at learning software systems, really make sure that you transfer those skills over to your medical coding resume. So things like if you're a fast learner, you're good with customer service. Thank you for subscribing to the channel today. By the way, I'm considering, and I don't know if anyone would be interested in, but I thought about, I have this membership through the YouTube channel that you can pay a couple of dollars a month to join channel membership. And then you unlock custom emojis. You have community only posts. You can get some courses that I have available. They just make available for CEUs, at least anyway, for my community members. So there's like my whole ICD-10-CM playlist that I have on my channel. You can actually get CEUs for that if you join the community, because I took those videos, built them into a course, hit the AAPC requirements that you have to have a quiz at the end and everything, so you can go through them, do the quiz, and actually earn CEUs for watching that content. But I'm toying with the idea of also having a paid channel member only, like Zoom chat. So like I would get done with the live stream, and then the paid channel members only would get linked to a Zoom chat that we would have maybe after the live stream, where we just sit and chit chat for 30 minutes and do that kind of stuff. So definitely keep me informed if you think that would be like a fun idea. Like if you would be willing to join, if you're not a channel member, if you would be willing to join channel membership just to have some time to just chit chat on Zoom. And Warho is asking, why is medical terminology so hard? Because it's based on Latin, first off, which is a whole other language. So medical terminology really is just, you have to mentally think about it almost as if you're learning another language. And there are ways, though, that you can make it easier because so much of it really is memorization. So you have to really try at it, really study. And the tools that you can find as far as learning medical terminology, I do have a video on that on the channel. I'll see if I can bring it up. I've been having fun with YouTube lately. They're having some kind of analytic crash or something right now where everyone who uses YouTube like dropped a ton of data for a day or two. So all of a sudden I like reloaded and lost 160 subscribers and panicked, but it turns out it's just some sort of data issue that they're having. So this is the video that I have over here. Let me bring it up over here. Let's see, uploads. There's my analytic data, videos. There's a video here that I have on learning MedTerm for coders. So you definitely, if you're having trouble with MedTerm, this is the video that you want to watch, MedTerm for coders, because I talk about the different ways you can learn medical terminology and some of the cheap alternatives. And then if you're investing some additional money, like the things that you want to invest your money in. So there's Quizlets you can take that will help you learn MedTerm. There's entire courses on YouTube, basically through freaking Hank, who's amazing for, oh God, Crash Course Anatomy and Physiology. There is a book that I really, really love. Is it back here? I must have moved it. I was just moving some stuff in my office, but there's a book called MedTerm for Coders. And that is the one that I absolutely recommend because what it does is as it's teaching you MedTerm, it draws in concepts in ICD-10-CM, in ICD-10-PCS, and in CPT and says, hey, when you see these MedTerms, here's some things that are related to medical coding. So that is a phenomenal, phenomenal resource. I believe I have it in the video description because I try to link it on every video because I just recommend it so much. So medical terminology for coders is the book that you wanna get. There's also flashcards you can get. These are the ones that I use. This is medical terminology flashcards. There's 1,000 cards in here. And they're basically like your prefixes, suffixes, and root terms. And with that, thank you for subscribing to the channel. With that, you can basically piece together anything. Once you know those root words, the prefixes and suffixes, you can kind of start formulating what all the different procedures are. Also, I wanted to ask you guys, what do you thought of this? I have been getting so many requests to do a lot more evaluation and management because everyone's so confused. What would you think if I made a video that was just an hour of me coding all kinds of different E&M services? And I called it literally, this is me coding E&M for an hour. And it would just be me going through cases like inpatient, outpatient, discharge summaries, skilled nursing facilities. And it was literally just an hour of me. And I'd probably I might make it a bonus thing. I've got so much stuff coming up, you guys. But I thought that would be something that might be helpful, like just literally an hour of me coding E&M. Yeah, it looks like that. So I might, yeah. So I'm seeing yes, that would be amazing. Yes. So that I think is something I might have to do, literally just an hour of me coding E&M services. And what I'm doing now is I'm starting to drop more stuff that I can share. So I'll try to even take the cases that I get and put them into like a PDF and then share that with you guys as well. Because I know some people like to kind of follow along on their own. I had to push back my cardiology thing. I found someone, thank you, Deborah, for subscribing, appreciate you. So I found someone who told me that they could get me some cardiology charts and that I could use them for the cardiology section that I'm doing, because cardiology is not my strong suit. Not that I can't do it, it just takes me longer to mentally process it because I don't do a ton of cardiology. So I found someone that's like, yeah, I can get you some cardiology cases, and then kind of ghosted me about it, and then didn't hear anything. And then finally it just kind of fell flat. So I'm hoping to get that cardiology one out today. But yeah, E&M for an hour, I think would be just interesting. Just literally an hour of just me coding E&M. Is the majority of the CPC exam CPT coding? It is. Actually, you can find the breakdown on the AAPC website. Let me go over here. Let me log out real quick. Okay, so if you go on the AAPC website and you go to certification CPC, it will tell you the exam breakdown here. I think it's all the way at the bottom. Yes. So down here is the full exam breakdown. So there's going to be, is it 10 questions on the 10,000, and then there's 10 questions on the 20,000. So there's basically about 8 to 10 questions on each section of CPT. And the only thing that's not going to be CPT is it says here 10 questions on ICD-10-CM, just ICD-10-CM. You may also have some questions that are CPT and ICD-10-CM, but there's 10 that are just ICD-10. There's going to be 5 HCPCS questions. So you could literally not even bring your HCPCS book to the exam and probably still pass, because there's only 5 questions that are going to pertain to HCPCS. And then there's going to be some questions that are just on coding guidelines, compliance, and then med-term and anatomy. But the bulk of it is going to be, CPT questions. So you can find that whole breakdown right on the AAPC website. Again, you just go to certification, and then to popular certification CPC, scroll all the way to the bottom, and it'll tell you the exam breakdown. And then there's also FAQs and stuff in here too. There's just it's tough because you spend so much time as a new coder just learning medical coding that it gets overwhelming when you're like trying to find things on the website too. Do companies require a certain amount to meet claims to code at daily work? Yeah, so there are productivity standards both in medical billing and medical coding. And that really depends on the individual company. There are some benchmarks that are out there that they'll say, hey, if you're doing physician coding or if you're doing E&M coding, this is approximately how many you should do in an hour. But that really can depend on the individual employer. Reason being is, Thank you. Thank you for the super chat. I appreciate you that, Miss Limitless 23. Really appreciate that. So the reason it varies is because the process can vary, right? So if I'm in a really efficient organization and they have Epic, and all I have to do is just click on the patient and it brings up the chart and I just type in and my codes, and everything is very efficient, I can probably code a lot faster. If I'm working in a practice where I need someone to send me PDFs, or I have to pull them off of some remote storage or go into a whole different system, that's going to slow me down. So obviously I'm not going to have as much productivity as someone who's just clicking a button and automatically the chart's there, and then it just tells you, hey, here, put in the codes, and you send it on their way. So the more efficient your process is, the more productive you can be as a coder. Also, if you have better tools you can utilize, then that will definitely improve your productivity as well. And in the reflections of productivity, I will say that while a lot of organizations, the majority of them, do have productivity standards, they will typically give you some flexibility. So they don't want you to go from just being a new coder to coding, 110 charts a day. They'll say, hey, we're going to give you something to work up to. So we're going to want you to be at this productivity level, maybe after month 1, month 2, be at this productivity level, and work up to the expected productivity level. So again, I just want to say thank you so much for the super chat. I really appreciate that. Arrow is saying, does every practice use super bills? It depends. So the super bill as we used to know it is not used as much anymore. So when I think of super bill, I still think of those paper super bills that I used to have scanned in and just punch in all the codes when I was just starting out. So there are paper super bills that sometimes private practices, definitely have seen them still using paper super bills. And then there are now electronic super bills. So some of the software that's out there now, you can have like almost like a pick list where it's like, oh, here's the common diagnoses, here's the common procedures you do. And they just kind of click it now on the super bill. And then some providers have favorites lists or preferred lists where they're like, here's the diagnoses that I know my patients commonly have, and they pick off of that. So yeah, super bills are still used, but not necessarily in the way that they used to be back in the day, and oftentimes in electronic format now. Yeah, Marissa's saying she's definitely worked where paper super bills are still being used. I've seen that recently as well. And sometimes it's not that they're on paper processes from the like billing standpoint. It's that they're still using the paper super bills, and then someone's like inputting them into their electronic billing system. Sometimes I think more commonly I see this with providers that have been in practice for a long time, and they're just used to their paper super bills. I think our new residents and newly graduated physicians are not using paper super bills. Veronica is saying, do you have a CRC boot camp coming up? Actually, now that you mention it, I have one coming up. It's next weekend. It is June 5th and 6th. I'm probably going to have to move next week's stream till about 3 o'clock because the boot camp goes from 10 a.m. to 2 p.m. and I need some time to take a breather. I am actually considering after boot camp, when I do my live stream, which I'll have to push back again till 3, I have someone who I've been considering bringing on the stream as a guest. So you might see a guest next week, but I'm going to have to push the stream back till 3 o'clock if that works for this particular person to come on and chat with everyone on the live stream. Can two providers of different specialties bill E&Ms on the same day in both the inpatient and outpatient setting? Most insurances will only allow a group to bill one E&M on the same day. So it's kind of up to your internal process of if they're in the same group, which one goes. But if they're different specialties, so like one is general surgery and one's wound care, if that insurance identifies them truly as different specialties, then in that case, one can bill their E&M, one can bill their E&M, but they can't both bill, like the general surgeon can't bill both an inpatient and an outpatient on the same day. The wound care doc can't bill an outpatient and an inpatient on the same day. It's only one E&M per doc per specialty, or I should say per specialty really, because most insurances recognize that group specialty is kind of like being almost the same provider, that they can't bill two E&Ms on the same day. How much is the CRC boot camp? That's a great question. That is a perfect question. Let me go over and show you guys right here. So the boot camp, so if you go to my website, contempocoding.com, it is here under courses, and the boot camp is $399. It includes the CRC study guide in ebook format. It is 2 days. So it is 10 a.m. to 2 p.m. Eastern Standard Time on Saturday and Sunday. You get access to the recordings, that they don't go away. I don't ever delete you or you limit your access in any way. So you'll have access to those to go back and refresh. It includes practice material as well. So there's a lot that's included in the boot camp. So if you're interested in that, I'm still taking registrations for next week, and there's CEUs available too. So if you have another AAPC certification, you can also earn 7 CEUs through the boot camp. Now, if you don't need a full boot camp or you need something more than a boot camp, I have options for that as well. So if you're someone who self-studied and you're like, I just want a quick, I want to make sure that I'm understanding this correctly and get like a little review and have some practice exam, I have a practice exam package that's only $29.99, and that includes, I believe it's 3 hours of just on-demand education. Take it whenever you want. And then I have the full CRC prep course, and this is based off of the AAPC's curriculum that I license, but then there's additional stuff, like I'm the whole one teaching it. There's additional information. I can actually, let me get in and I'll show you guys a little bit of what the full course looks like. So let me see what I got here. My account. I can do a little course preview for you guys. Courses. Preview. Course curriculum as a student. Okay. So this is what the course looks like when you get in. There's a little introduction. There's a toolkit that has all the different data pieces that you're going to need. So things like your HEDIS measures, things like your HCC mapping, some short lists, the risk adjustment data validation audit listings. And then here's all of the courses down here. So you can see the first couple are kind of similar to what you'll see with the CPC curriculum, but then down here's where it really starts getting into risk adjustment. And you can have access then here to, where is it? Risk adjustment models. So there's videos, there's a quiz, there's extra practice cases. I'll turn the volume down here so that doesn't play, but you can see it's kind of formatted like I do here for the chat. Like there's the course and then there's me. And I actually have updated videos. I'm still trying to edit and get in so that I'm a little bit bigger, and then I kind of pop in and out when I'm blocking something and so forth. So the full course is available on the website as well. Yeah, the practice exams are great. I got some feedback recently from someone who took them, and they said the practice exams, based off of what they took in their CRC exam, were like completely on point. So, you know, I formulated, this is like a custom exam. Like if you go onto the AAPC website, you won't be able to get a duplicate of there because it's one that I formulated based off of what I saw in some of the curriculum. And I knew were things that they're more likely to test on. So the guidelines that I know they like to put in the exam based off of all the different curriculum and study materials, that's what the practice exam is based off of. Can a person with CPC certification work as an auditor of medical billing companies? Is there other certification required? So there is an additional certification that the AAPC has. It's called the CPMA. And the CPMA is the Certified Professional Medical Auditor. There are more organizations now that are looking for that CPMA credential because they want to make sure that you have a basis of understanding on things like statistical sampling size, on things like the OIG, on federal regulations, on how long you have to send money back after you discover that there's been a billing error. So the CPMA is starting to be more requested by some organizations. The other thing to think about is most of the auditing positions that I've seen have a stronger year of requirements than just the CPC. So most auditing positions, not all, but most auditing positions I've seen require at least 5 years of medical coding experience before they will consider you as an auditor. Yeah, Marissa's saying she wants the CPMA. I think from what I've heard of others that have taken it recently, it sounds like it's a lot more difficult now versus then when I took it. I heard there's a lot of infusion coding questions, and those are some complicated concepts. One of the things I tell people if they're ever interested in the CPMA credential is the thing that you really can't miss. Oh, I got to close that out because that's going to drag my internet down. One of the things you can't miss if you're going to take the CPMA exam is that they have these additional resources over here. So CPMA, Certified Professional Medical Auditor, and then I think it's under Prepare for the Exam. And then they have this additional preparation methods down here, and you cannot miss this because they're going to list for you all of these additional things that they want you to look at and kind of review because they're going to test you on it for the exam. Hooray for Travel says, I'm an RN who recently passed my CPC. What jobs besides CDI, CDS do you know with my background? I'm currently working as a CDI for the last 3 months, but looking at all of my options. So I think CDI is great, but there's definitely some other options. There's nurse reviewers. I have a friend who is an RN and does a lot of things for in regards to auditing that I wouldn't say are CDI, but reviewing for almost medical necessity, kind of looking at the claims and going, okay, you know, this was submitted from a clinical aspect. Was this medically appropriate? So there's a lot of work in that as well. Being kind of a clinical, I don't want to say clinical validator, but an auditor almost from that aspect, from seeing the codes and being able to determine clinically were they appropriate. Nurse auditor, maybe, I guess they refer to it as. I just heard my alert go off, but I'm not seeing my star. I'm not seeing SpongeBob. What's going on here? My alerts are delayed. We're going to see a star probably pop up right here, or SpongeBob, in like 2 minutes. So do you have CEUs for free for coding and billing? I have a couple. I shouldn't say I have a couple. I have one free CEU course. I used to have a couple, but one of them I retired because I think it was about 3 years old now. And it was my Why Risk Adjustment Coders Are Making More Money. I retired that one because after 3 years, I'm like, you know what? It's time to take that down and maybe do something different, maybe a newer version of that. So right now I only have one free course. It's on modifiers. I have approval to get a couple additional courses. So I'm looking at developing some more. And I do have the CEU approvals for them. I just have to get them together. I do have some events I'm speaking at, I think, coming up. I have one that I'm doing for Gentum Health. That is a webinar I've been putting together, the most expensive diagnosis coding errors, I think, and how to correct them, I believe I called it. I'm trying to see if I'm going to any chapters anytime soon. What have I got? I think I try to do 2 chapters a month. I will be in one of the Florida chapters on the 10th. Well, not in, but presenting for one of the Florida chapters on the 10th. I think I'm doing lesion coding for them. I wrote down Cala, Florida, but I don't think that's right. I think it's different. But yeah, so I will be putting some more free CEU courses on there, but right now I'm catching up on some YouTube stuff. I did an interview this week that I have to edit and put up. I have the cardiology thing that I still need to get together because I have all the cases I have to put together and record that. I have another interview with someone else coming up, and I think I have a whole video that I've already recorded. So there's a lot of great new content coming up. Amani's asking, why did I skip over your question? Because there's a lot of questions being asked, and I don't intentionally skip over anyone's, but I will see what you've got. So what should you mainly focus on for the CPC exam, Amani? That is a great question. What I just showed you on the website is what you should focus on. So if you go back over, we were looking at the AAPC website for CPC. So you go to certification, you go to CPC. I apologize. Let me get my face out of there so you can see what I'm actually doing there. Certification, CPC, and they will give you the exam breakdown at the bottom of the website. So here is what you should be concentrating on for the CPC exam. Now, I can't tell you, oh, they're going to ask you this or, oh, they're going to ask you that. Because there's so many versions of the CPC exam. Not all of them are the same. There are actually multiple versions of the CPC exam. So I can't say for sure, oh, you're going to get, infusion coding. Oh, you're going to get this, you're going to get that, because there's different versions. What I would recommend is to get some practice examinations. Once you're at the practice examinations, really learn from those practice exams. Look at the rationale for ones you didn't get wrong. Look at the rationale for ones that maybe you thought you might get wrong or you were confused by or not certain, so that it reinforces for you. When you're at about an 80%, that is a good indication that you're probably ready for the CPC exam. There are practice exams you can buy through the AAPC website. There's no package one that's better than others. And there's other people that have practice exams as well that you can purchase. I think CCO has some. I have some on my website. So practice examinations, or there's some I believe you can get. I've seen some even on like eBay. There's independent vendors that have some available. And then step-by-step medical coding, you can get practice through them as well. Why are we talking about Pennsylvania? What's going on here? What are we doing? I'm moving to Pennsylvania, my home state, in a few months. That's where I'm from. I'm from Eastern Pennsylvania. I'm not too far off from Philadelphia. I'm maybe hour and a half west of Philadelphia. So yeah, it's cold as heck though in Pennsylvania today, man. Oh yeah, Jamie's saying make sure you know your guidelines. That's another thing for the CPC exam. They're not so much testing you on I know how to look up a code as much as I know how to apply the guidelines. So they'll may ask you a question about lesions, but they're going to really test you on not just, oh, well, it's a 6 centimeter lesion. They're going to test you on this was the margins, this was the lesion size, and you being able to calculate that and determine the lesion excision and the suture enclosing. And is that suture going to be included or is it not going to be included, because simple closures are included. So they might be testing you on that type of knowledge as well, just the guideline knowledge, not just so much this converts to this code, but really, truly the guidelines. Jocelyn's asking, when studying for the COC, what would be some good things to study when it comes to surgery and modifiers? A lot of it really is on surgery because of things like the ambulatory surgical centers. So they're going to test you a lot on surgery. They are going to test you on those G outpatient E&M codes, and they're going to test you on the modifier specific for, specific for outpatient. So they will, I believe there's even some, excuse me one second. I believe there's even some things on the 25 modifier. The interesting thing about the COC exam is that it's broken down different than the CPC. So if you look at the certification for the COC, their exam breakdown, which I think they put this somewhere else, I think, for this section. Hold on. Oh, here we go. So this is broken down. So there's going to be a little bit of med term, a little bit of anatomy, a little bit of coding guidelines. And then when it gets kind of down here to CPT, you know how we looked at the CPC and it was like the 10,000 series, 20,000 series? Really what they're going to ask you about is the differences in E&M. So the emergency department, outpatient clinics, observation, critical care. And they're going to ask you about surgery. So these are the ones that they're mostly going to test you on. Surgery that you would commonly see in outpatient hospital facilities. So a lot of things like your cholecystectomies, your hernia repairs, things that are day surgeries. And then there's going to be a lot of radiology and lab and path involved as well, and medicine. So as far as what surgeries to concentrate on, day surgeries, not like your complex surgeries where the patient's going to be in the hospital for the next 3 days. Things like they're kind of in and out. They're going to the ambulatory surgical center. They're going to have something, maybe like an AV fistula placed, and then they're going to get out. Do I have the live chat and the recording? Yes. And what I started doing actually last week, and I don't know if I'm going to be able to keep this up because it was kind of labor intensive, but I'm trying to do timestamps, but it's difficult because in the hour I'm answering like 40 different questions and I have to make 40 different timestamps. But yeah, the live chat should be in the recording unless I changed the settings, which I hopefully didn't. Hold on, I'm going to check that out now. I don't know if they'll allow me to change the settings while I'm in here. If not, I'm going to have to change the defaults because I know last time I forgot about it. Let's see here. And I don't know that they delete the live chat. Let's see if I can edit it live. I don't know if YouTube's going to let me do that. Where's my setting? I don't know that it's going to let me do it. It should show the live chat after it. If not, I'm going to change my settings. Can I do a video for CPT guidelines only? So here's the issue with that. The AMA owns the rights to all of the guidelines. So I can't create a video that would, in essence, become a replacement for a large portion of the book. Like you wouldn't need to purchase the CPT book and read over the guidelines because you could go on YouTube and find a reasonable facsimile. So I can go over components of it, but I can't show major portions of the CPT book because of copyright and because the AMA has much larger pockets and better lawyers than I do. So I can only do things that are within the scope of fair use. And since they own those CPT guidelines, you know, it's kind of a fuzzy area. I do have lots of CPT coding videos available. So if you go onto the main channel, so I can show you guys some stuff here on the main channel. Let me just get over. So if we go onto the main channel here, Contempo Coding on YouTube. So there's a few playlists that I have. So if you're like brand new to medical coding, this is the playlist you want to watch. And then I have CPC exam tips. So if you're looking for CPT coding stuff because you're prepping for the exam, for the CPC exam, this whole playlist is what you want. As far as CPT coding, I don't have a specific list or videos that focus just on CPT coding, but I do have this series that where the heck did that come from? I don't know how I have to get on there. So I have to remove that. This is the funny thing about playlists. I probably put that on my watch later and it popped up. But this playlist, you can see integumentary, musculoskeletal, respiratory, and then cardiovascular is next. And then I focus on not just the CPT, but also a little bit of ICD coding for those particular specialties. Hi, when you do videos for coders with questions concerning different issues you see when working, I would have to know like what kind of stuff do you want to see? Like if you're having particular issues and you need suggestions of what to do, like if maybe you're seeing HIPAA violations or you're seeing issues about like management, like your manager just doesn't like you or she's giving you bad audits, like give me that kind of feedback and I'll see what I can do for it. But if it's something like I'm having severe problems coding for interventional radiology and I need you to tutor me, I don't currently, but I have provided tutoring services. I don't do it frequently. But you can probably find tutors more readily and for a better fee at tutors.com or wyzant.com, WYZANT, if that's what you're looking for. If you're looking for something that's more like consulting services, then I do charge for those as well. So if you're looking for what I try to do is if it's something I can answer in a minute or two, I'll generally help. If it's something that I have to really research and dive into, then it's something that I'm likely going to charge for. When to use modifier 21? That is a great question. Off the top of my head, I don't honestly remember what modifier 21 is. Let me look it up. When to use modifier 21? Let's see here. 21. That's a HCPCS modifier, it looks like, because it's not in my CPT book. So if I go to my Appendix A, that's where all of my CPT modifiers are. 21 I'm not seeing. So I would have to go into HCPCS to find that, I'm guessing. Let me see here. So modifier 21. That doesn't sound like something I'm super familiar with. Where are my modifiers? I just got a new HCPCS book, and I'm still trying to figure out the layout of where they have everything for it. I should probably tab this. That might not be a bad idea. So let's take a look at our modifiers in our HCPCS book. Modifier 21. That is not one I'm super familiar with. Let me take a look here. Doc Cam. E1, A2. There's my alphabeticals. 21. I'm not seeing a modifier 21 in any of my books. That would be something I would have to Google. So unfortunately, I don't have any information on the modifier 21 for you. My apologies. Marissa's saying it's a deleted modifier. So there we go. Maybe I could find something in Codify. Let's research it out, you guys. Let me check my Codify and see if it'll tell me there. AAPC Codify. I feel like I wish I could get like affiliate income from Codify, because I could get so many people probably to sign in just by showing everyone how I use it for my lookup. So AAPC Codify is the encoder program that I use, and it helps me look up things. It helps me determine bundling issues. It helps me get lay terms, which is so helpful when you're just learning things. So let me log out. Okay, I was probably on my other computer. Modifier 21. Let's see what it tells me. Nothing. No indexes, no codifies. Modifiers, yeah. I don't know. So we have a question here from Mariana. She's saying, hey, Victoria, does going to school and getting a certificate in medical billing and coding get 1 year removed from your apprentice status? It can. So if you look at the requirements on the AAPC website, it will tell you that you can do that, but what you need is to prove the amount of hours, because what they're looking for is 80 hours of education. So that is what they're looking for. Let me see. Remove your A. Apprenticeship status, remove your A. So what they say on the website is that you have to send proof of education in the form of a letter from an instructor on school letterhead stating you have completed 80 or more contact hours, a certificate or diploma stating at least 80 contact hours, or an unofficial school transcript. So they're really looking for either that amount of hours or the school transcript, which will probably have some sort of correlation then to the hours as well. Where did my thingy go? Okay, here we go. Tammy is saying, Tammy, you're going to Epic in March. Congrats. I love Epic. I've worked with some programs in the past year or two that I'm like, man, anyone who complains about Epic, they need to use these programs because they're not great. And I would much rather use Epic. The thing I loved about Epic, especially when I was working as an auditor, is I could go in, like, here's what I'm looking for. I clicked on the patient. It took me to the chart. I could go into the bill that was generated based off of that note. Like, it was all very intuitive. I didn't have to go around searching for things. The last program that was an EMR that I worked with, if I was looking for a patient's bill, it was basically like a bunch of unlisted bills. I had to look at each one and go, is this the one? Is this the one? Okay, maybe I can narrow it down a little bit by date. Nope, this is ophthalmology. Nope, this is radiology. Nope, like Epic just is a lot more intuitive to find what you're looking for. That in turn can also be overwhelming because there's just so much you can do and so much you can program. But I think it's great. I'd rather work with Epic than a lot of the other EMR softwares out there. Patty says, I use my HCPCS solely for modifiers. Every modifier is listed inside the front and back covers in the AAPC version. See, that's the thing. I should have the AAPC version. I got the Optum version. And I thought this version would have the status indicator codes in it, and it doesn't. It does not. But I don't think this one has, this one doesn't have the modifiers in the front. It has them like in an appendix in the back. But thankfully, I don't have to use HCPCS that often. So I'm not sure if I missed something in the conversation here. Oh, Elisa. So I've taken the CBC test 4 times and failed. I want to be a coder, but this test is making me feel defeated every time. Any good tips to keep going and not quitting? Well, the first thing I want to ask you is, why is it that you're getting into medical coding? think about that. Think about the outcome and focus on that. Is it because you're looking to get into a specialized career? Are you looking for a job where you can work from home, where you can take care of your family? I know a lot of people, their why is, I want to get into medical coding because I just want to be able to have a good, stable career to support my family. And that's fantastic if that's what you want to do. But the better thing on that is, do you still enjoy medical coding? Because you want to get into a career that you at least are able to deal with day in and day out, right? That you still are interested in it. Not that it's something that you would do maybe in your spare time, although some of us do have that aspect of it, but something that you enjoy doing and you could see yourself building a good career with. So there are people, I just saw someone today that said that they took it 10 times and they're glad that they did take it that 10th time, because years later now, looking back, they can see where it was just so important not to give up, because they have built such a career by passing their exam and going through there. I have some strategies you can look at too on my YouTube channel on what to do if you fail the exam. So really think about that. Really concentrate. Like, if this is truly what you want to do and it's your passion, it's going to be hard, but the reward is going to be worth it. So as frustrating as it is to take the exam multiple times, particularly in person, because you're almost throwing away your entire Saturday, when you look back one day, you're going to be so grateful and thankful to yourself that you didn't give up. Mallory says, I have no experience in the healthcare industry, but I received my CPC. Is it reasonable to believe that I could get a fully remote foot in the door job? It is possible. It's, it's not guaranteed. It is not something that is possibly going to be easy, but it is certainly doable. There are a lot more positions now that are remote, especially things like entry level. So what was happening for years is, even though medical coders a lot worked remotely, there were still organizations that were just so reluctant that they're like, no, we have to have them here, because what if the providers have questions and they want to know that someone's sitting in a cubicle somewhere and they can call them on the phone and ask them, or they just, thank you, Maria, for subscribing. Or they just felt like, we want to watch them. We want to make sure that they're actually doing what we told them to do. We want to be able to go over to their desk and talk to them. So there are jobs out there, because more employers, now that they were forced through the pandemic to realize, oh, we can train people online, we can do our orientation online. Now there's more positions that are really opening up that are allowing new coders to start out just remote. So what I would suggest is definitely check out codersdirect.com. And what you can do if you're looking for specifically remote positions, you can, and again, that's Coders Direct, CODERSDIRECT, codersdirect.com. That's a website that has jobs just for medical coders. And you can set this location here for your search to remote. And that way, let me know if I'm lagging right now, because I kind of feel like I'm slowing down. But you can set this to remote. And then when you search, it'll just show you remote positions. You could also narrow it down if you're a CPCA and just looking for remote, and you can search just for jobs that are remote, and they will accept CPCAs. Oh, good. Okay. Whew. Yeah, I know there's traditionally a lag between like when I'm actually speaking and you seeing me, because it takes a while to transmit the data. But I know sometimes like I'm clicking on something and saying something and my words are all out of sync and so forth. Okay, good. Awesome. So Patty's saying, when looking for a job as a CPCA, is there a specific department that's more likely to accept new coders than others? I wouldn't say necessarily a department. Sometimes you can get into billing easier than you can get into coding. It really depends. But they like to have coders in the billing department because they know that while you are not in a quote unquote coding role, they like you to have that knowledge so you have that better understanding when you see a denial, like, was this truly maybe something that is a coding related denial? Was it not? Was it because, there was a mismatch in the patient's age or something that we used a code that was age specific and it wasn't in the right age range? So they do like having people that have that knowledge base in the billing department. How can you contact me? Are you talking about me, or are you talking to someone else in the chat? If you're talking about me, I'm available through, social media. You can comment here. But if you're contacting me because you need personal advice, or you need me to coach you or mentor you or tutoring, those are services that I do charge an hourly rate for. So while I do present on the live stream and answer questions here, if you're looking for personalized information specifically towards you, that is services that I do typically have an hourly fee for. How do you become an E&M coder? Well, first you pass your CPC, and then you can get into an organization that will hire you as an E&M coder and throw you 100 million cases a day, and you'll get real good at E&M doing that. There is an additional certification that the AAPC offers in E&M coding. So it is the CEMC, and that's just on evaluation and management coding. So if you want to specialize in that, that might be a certification that you could look for. So that is on the AAPC website. If you go certification, and to, let's see, view all certifications, and then specialty, there is the certified evaluation and management coder. And there will be some insight here on how to prepare for the exam. So there's a study guide, so you can learn more about evaluation and management there. And that will give you the appropriate training to put you in alignment to get positions as an E&M coder. Oh, good. You were talking about someone else in the chat. Okay. I wasn't sure. Okay. So I am getting a question here. Does having a legal record or being on probation prohibit you from working as a CPC due to HIPAA? That would really depend on the individual organization and their particular policies. There isn't anything that says a CPC can or cannot do that because of those sort of situations. It really depends on the employer and what they're looking for, and if they have that as a barrier when they're doing pre-employment screening. So it is now 3:03. Thank you guys so much. I am extraordinarily happy to be with you guys here every Saturday. Again, I'm going to have to move next week's stream just a little bit later, but I might be bringing on a special guest. So this particular person that I have in mind, if they are available to come, does inpatient coding. So if you're looking for information on that, and they're also an HEMA person, so any HEMA information, we might be asking some questions on that. I will see you guys next week. Hopefully it will be warmer next week. But until then, I want you guys to just keep on coding on.